Greetings, everyone. This is Dr. August. So part of the process of talking about different ways to give injections to patients, inevitably what you come across is that there's different devices on the market. So as we're talking about diabetes, what you probably have seen is a lot of new GLP-1s that have come to market. And usually what we come across is, let's just talk about first, like just how you inject. When you inject, something is basically going through a syringe or a needle into the body, whether it's IM, subcutaneous, different ways, just throw that out. Let's talk about like the form factor itself. And the reason why this ties to diabetes is because we've seen a large rise in what's now called auto-injectors. So traditionally, when you think about, for let's say diabetes, we talk about like insulin, like, right? So we have like an insulin pen, just talk about a geriatrics case. What's the value of the pen is the fact that you can put like, on a needle right here, you can calculate out how many units you want to give and inject it. So drawbacks to the pen in terms of pharmaceutically is that you got to buy the needles. You got to basically then prep for everything with that and such and routinely give. So this is great for like insulin products, for things that you're giving multiple doses, multiple times throughout the week. We've seen some GLP-1s use pens and such. The issue is, again, like where could you go wrong for a patient is that, okay, how many units do you have to inject at that point in time? So what people have been trying to do, especially because the GLP-1s use a fixed dose, is move towards basically giving them all in one. Now, traditionally, what we've also seen is for many medications or especially like, let's look at like Humira, for instance, right? So Humira comes in many different devices. Traditionally, one of the ones you see that are used, though, is basically patients get sent a box, and the box is basically a syringe, and they will inject it. This is a fixed dose that they have to do, but again, like if they have a needle fear, if they don't like seeing this, they may not be as adherent or want to use this correctly, and those are like drawbacks. So Humira also comes in a pen itself. Now, other things you've seen for pens is like an EpiPen. So this is like a demo device, but again, you have to like instruct patients how to use it correctly. Like you have to take off the safety, but you don't inject out into that area. The pen actually injects right on the orange part. So some patients actually mess it up because they actually take it off like the cap. And then what they'll do is they'll try to actually then inject, and then they'll actually inject the wrong way. And we've actually had, unfortunately for children, actually stab themselves in the fingers, and you can actually lose the fingers. And it's quite makes sense, right? You think about like, a pen that you're going to write with, take out the cap and it's right there. So the auto injectors have come out. Now, well, they are supposed to be a one-step thing. They're supposed to be a fixed dose in use. Two of the most common designs right now you see in the US is like two different form factors. So I'll focus on semaglutide right now. So semaglutide made from Novo Nordisk goes in three different brands. You have Rybelsus, which is an oral formulation. You have Ozempic, which is traditionally then used for diabetes. And then you have Wegovy, which is now used for weight loss. And the Wegovy one we see a lot for is using an auto-injector form factor. Then you have like Eli Lilly. Eli Lilly uses a different kind of auto-injector, and it basically has a different process steps, but most of their auto-injectors all use the same design, whether that's for migraines, for relief, GLP-1s and such. So the one for Wegovy is a two-step device. Basically, you remove the cap, and then what you do is you just press. And what you will see is, like, if you can see on the screen, you can see actually the yellow bar moving across right there. And there's a second click. So it's a two-step device. So I want you guys to practice with this and see that. And what a patient has to understand is when they inject themselves, they have to hold it at the right position and keep it there until fully inject. And the nice thing about this is the needle's closed in this. The patient doesn't have to put a needle on or anything like that. They carry it around with them. It's easier to transport and such. You still have to prep, alcohol wipe in the area. But the biggest thing is that these are meant for like weekly use, monthly use devices. A lot of biologics now come in like this kind of form factor, these kinds of devices. The ones from Eli Lilly is a three-step device. So you have to remove the cap, and there's actually a safety on here. And then you basically turn the safety off. And then what you would then do is you would put it on, and then you would press. And the same kind of idea as if fully ejected. On this one, you can see like a green line like moving across. And they're both about 10-second injection at the end of the day. So what you have to explain to patients is that they have to use it and hold it correctly and hold the right position and such. Eli Lilly device, you can see this kind of auto injector has a flatter surface, which is meant to keep more of like supplied at like a 90-degree angle, because you technically could like this one like kind of like move it side or way and not get a full injection or not get in the right tissue and such. So ultimate instructions for you guys is that if you come across medication, if you work in specialty or now with a lot of these medications being in a lot of community pharmacies, is educate patients in terms of like what steps there is. Now, I'm not telling you what exactly steps for each of these devices is. It's good to like pull them up, read the instructions for use or IFU that comes from the packaging. But for patients that have questions about that, it's like walk them through like, what's the process for these types of things. So that's the design and differences between these different ways to inject patients with medications. And the nice thing is about with a lot of these different forms is the patient doesn't have to go into the clinic, don't have to go into an infusion center to get an IV of a medication. They can just self-inject at home, which reduces cost, time, mobility, having to like logistically think about how long they could go somewhere get an infusion, so they can do that at their own convenience. But again, they have to do it the right way. So make sure to review, for each device, if you ever come across it, like look at what's called the IFU or instructions for use that helps you guide the patient in terms of the steps they have to go through for it. So yeah, that closes up this discussion about just different ways to inject. We will have these auto injectors in class, so play with them so you can see. And keep in mind, like there's many different types of auto injectors on the market, so they all have different steps, and that's the key thing. So if you have a patient that's on, let's say, on like a device like this, and they switch to a device like this for a medication, say there's a medication shortage, right? What ends up happening is they may not be understanding like the differences of use. So these things they have to be instructed on. This goes for a lot of different products, especially biologics now in the market. So again, thank you for your time and thank you for listening. Have a good day.